I didn't start out looking to work in diabetes. I was hired into a job several years ago, and my goal was to find a part-time job in nursing while I had young kids. But I was hired to work for the diabetes clinic. And shortly after I started working in the clinic, I realized I had a way of doing things that seemed to work well for people with diabetes. And it was a whole new field for me, and I had an awful lot to learn, but I really enjoyed that. And I worked with a team of people who took the time to train me. So that was another thing. Working for the organization, I really was given the opportunity to basically do a residency in diabetes while I was actually working as a nurse. And that was an opportunity I couldn't pass up. I didn't start out to be a nurse or a nurse practitioner. My first degree is in philosophy, and I went back to nursing school in my late 20s. I had spent some time traveling overseas, and while I was overseas, I had come into some situations where people needed help, and it was typically medical help, and I realized I had no skill set. And one of the things I'd hoped to do during that time in my life was spend more time traveling. So I came back to the States and went back to nursing school so I would be able to bring something with me wherever I went. And that's been a very important part of my life since that time. Because there's one thing I know, wherever I go, I take my nursing with me. And that makes me valuable, and it gives me an opportunity to connect with the people in my community wherever I am. And I didn't expect I would live 25 years in the community. I didn't expect I would have kids here and raise them here, but this is my home now. So the organization I helped start in 2008 ultimately transitioned into Center Moves. And the goal there was to really work outside the health system to help raise diabetes awareness, but also engage the community in helping build a healthier community all around us. I mean, one of the goals in the work that I do is to actually put myself out of business. If I do my job right and I create or help create a healthier community, most people won't need what I have. And I'd much rather move on to something else because people don't need what I have anymore because we did the right thing in our community. The most important thing to me when I walk into a patient room is looking at somebody and looking them in the eye and communicating to them, whether it's by talking to them or just by how I am with them, that they are important to me, that they matter, and that what we're about to do is something that's going to help them be better.